It is time to check in with Dr. Joe Schwarcz, host of the Dr. Joe Show, Sundays at 3 here on CJAD 800, and of course, director of the McGill Office for Science and Society. Joe, I see the first topic, and I'm very interested in this. My wife uses this. I know other people who use these in various different ways, and these is red light therapy. So for skin improvement, although from what I read online, you can use it for anything, apparently. You could grow a limb if you have red light therapy. So let's get to it. What's it effective for? How should you use it, if you should use it?
Well, I think you can forget about growing a limb.
Okay, take that off.
Obviously, there's a lot of interest in light because without light, there is no life. Photosynthesis, on which all life depends on light, right? Because our food comes from plants. Plants cannot live without photosynthesis. And also, of course, not only do they serve us as food, but they also produce the oxygen that we breathe. So obviously, light is important to life. So it stands to reason that researchers began to explore whether or not light therapy could also have some sort of potential other than just, creating life through photosynthesis. And it wasn't long before we learned that exposure to ultraviolet light, for example, can increase vitamin D formation in the skin, but excessive exposure can also damage the skin. So we saw both the pluses and the minuses. Then the question was whether or not light does not damage the skin, which is like in the visible range of the spectrum, including the red range, whether or not this can have any kind of effect. And it turns out that it can. However, there is a lot of nonsense involved in this as well, because some clinics advertise what they call intravenous light therapy, whereby through a tiny puncture in the skin, they insert a catheter through which they can insert an optical fiber tube, and that shines light directly into the bloodstream. And they make all kinds of claims for this. They claim to increase energy by improving mitochondrial function. They claim to counter the side effects of chemotherapy. They claim to boost immunity, which is, of course, a totally nebulous claim anyway. These are clinics that really I will put into the pseudoscience realm, because there's no evidence that any of this intravenous light therapy has any kind of an effect. And it could also have a risk, because you can get infections at the site where they put in the catheter. So this, I think, is just nonsense. However, red light therapy, whereby you expose the skin to red light in various forms. I mean, there are local devices that look like flashlights, which will emit red light, usually in the 600 to 800 nanometer range. And there are whole banks of light that you stand in front of. There are helmets that have little bulbs that will shine red light. So there's all kinds of devices. So the question is, what is the evidence here? And actually, there is some. When it comes to skin problems, the claim is that it can improve acne and that it can reduce fine lines, that is, it can reduce wrinkles, and that it adds elasticity to the skin. Now, when you look at dermatological journals, which I do look at, you do see some pictures where certainly the fine wrinkle lines are reduced. But there's really a question of whether or not this is going to be observed by an objective onlooker. I think someone looking in the mirror and looking very carefully will see some improvement. But in terms of dramatic improvement, I don't think that there is any. But at least there is some evidence that it does something. There's actually more evidence when it comes to muscle aches and joint aches through a process called photobiomodulation. You have all these, devices that emit the red light, And when you take a look at the research on this, it actually is somewhat impressive, at least in the volume of research that is out there. And there is evidence about tendinitis improving, about people who have osteoarthritis with red light therapy.
Just by focused
Yes.
red light?
Just by focused red light.
Okay.
Yeah. Some people claim relief from neck pain and back pain. However, significant effects are only seen when the therapy is used several times a week, and it takes several weeks until you notice any kind of an effect.
Mm-hmm.
And if there's an effect, of course, you have to keep doing this. Also, you have to make sure that you have the right kind of device.
That was my next question, yeah.
The appropriate wavelength, and it has the appropriate wattage, which is measured in milliwatts per square centimeter. But, you can go online and find devices that are recommended for this. And then, of course, there are also the claims about growing hair. And you see the various helmets and caps and headbands and combs that claim to stimulate hair growth when it comes to male pattern baldness. And actually, there are some clinical trials here, too. And there is an effect. There is, with prolonged use, and we're talking about 30-minute sessions several times a week for at least 6 months. And what you can look forward to under the best conditions is an increase about 30 to 40 hairs per square centimeter when compared with the placebo. Now, that is something that is noticeable but hardly dramatic. And, it requires this long
big commitment in time, Yeah,
commitment and time. Now, if you combine it together with topical minoxidil, which is a drug that you rub into the scalp, the results are better.
So that's Rogaine, right, for the brand name?
You can even improve the results if you take oral finasteride, which is a drug that only men can use. Women cannot use it. So, it's an interesting story.
Do your homework. I think do your homework is the takeaway here, right? Because as you just said, they're not all the same.
Absolutely. And, some of it is utter nonsense, the intravenous use.
Yeah.
And the rest is possible.
Okay.
Now, there are some important medical uses as well. It's called endolaser therapy, which they use to treat varicose veins, the bulging and large veins that some people can get in the leg. Now, this is a treatment where they do intravenous, where they put a catheter in and shine laser light through it. But this is done by a physician. And the thrust of this is to heat up the tissue in order to collapse the vein.
Right.
So this is something that is completely different. This is not what the pseudoscience, clinics claim.
That should be handled, as you said, by a professional. Joe, we got to wrap it up. All right. Thank you very much. We'll talk to you again next week.
Okay. Thanks, Aaron.
Unmistakably Canadian.
It's the music that raised you.
The artists raising the bar.
Hi, this is Bryan Adams.
Hey, my name's Brett Emmons. I'm from the Glorious Sons.
Hi, I'm Nelly Furtado.
Made in Canada. The station that champions Canadian music.
Loud, proud, and all yours.
No passports required. Just press play.
Tap into Made in Canada now on iHeartRadio.ca
or the free iHeartRadio app.